and we are supposed to be there for emergencies, not only obstetric emergencies, gynecologic emergencies, but just really routine deliveries as well. Hello, everyone. So it's been some time, but here I am back again. Dr. Aisha Rush here. Wanted to come and speak with you all about the role of a laborist, or some people call us hospitalists, or ob-gyn hospitalists. I'm doing this mainly because I think that it's something that some physicians themselves just don't quite understand in our field, and kind of what we do and what our role is. But we are a very large growing specialty that really was necessary. I truly believe that there was a group of people out there who really knew that we needed to be able to provide care for women safely, but also do it without being burned out. And many physicians get burned out, and that is not an unreal thing. It is very real. I was one of those doctors, as a matter of fact, and working being on call, I should say, every other day and every other weekend was overwhelming. I did not see my first few children grow, and that was a problem for me, because as you all know, I am the mother of 8, and the only way that I can be a mother of 8 and also be a wife and also be a great doctor is by having adequate rest, and also just being able to mentally just relax, relate, and release. It's hard work when you come out of surgery and you have office, or you come out of a very difficult delivery or a difficult cesarean section and you have to go to the office. I mean, sometimes, for some doctors, it can be you get mentally spent, and you need to be able to have that downtime. And sometimes when you have office right after some of these things, you don't really get a chance to kind of reset. And that's not good for the doc. It's not good for the patient, and it's not good for the doctor's family either. So I also wanted to talk about this because some patients don't really kind of know the model of some of their hospitals. And, there becomes an issue when they want their doctor to be there to deliver, and the hospital has decided to use hospitalists, or the group that they decided to go with decided to use hospitalists, and they want to see their doctor. And rightfully so. This is somebody who's been taking care of you for your entire pregnancy. Not having them there because they've understood everything that you've said up until that point is kind of difficult. But the other thing is that I want patients to know that when things like this happen, when your doctor has chosen to use us hospitalists or laborists, they are letting you know that they have a good quality mindset about their limitations and being able to be there for you, but also balancing their ability to take care of themselves, take care of their families, and different things like that. And that is the reason why a lot of hospitals use us. That's the reason why a lot of doctors' offices use us, but also because it creates safety. What many doctors need to understand about our specialty is we are the people that are there when stuff hits the fan. So we are the people that are there when things just go super crazy, and we are supposed to be there for emergencies, not only obstetric emergencies, gynecologic emergencies, but just really routine deliveries as well. And so we are a specialty that does require quite a bit of experience in terms of what we do and what we're capable of. We definitely have to stay on top of our ACOG guidelines and different things like that, because we sometimes in the hospitals can be the safety officers, stopping inductions when they're not supposed to be done before 39 weeks if they're elective, different things like that. But we also are there to be able to provide that quality, safe care for patients that they require and that they deserve. So many docs will often actually ask us to, take care of their patients so that they can have that bit of a break that they need to rejuvenate, to renew themselves, that kind of thing. And this is what we do. This is our specialty, right? So we don't mind helping in ways that we can help. Now, for some of the docs who do utilize our services, we are not residents. I just want to put that out there, because a lot of times some doctors feel like we're there to do their scut work, and that's really not what we're there to do. We're really there to to be that safety person to provide safe and appropriate care for patients. We're not there to fetch your labs or to do your notes or things like that, because again, we are a respected and a needed specialty. And so please treat us as such. That's all we ask. We're physicians just like you. And for some of us, our training is extensive to the degree that we actually are the people that are called when a patient is having a severe emergency like a hemorrhage and different things like that, because sometimes our knowledge base and our experience puts us in positions to be able to have a bit more experience in those emergent situations. So again, we are physicians just like you, and some of us may actually have little different training or, a more extensive training or sometimes even experience. So again, we love when we're not treated like residents. That's all. Other than that, I want the patients to know that we are going to care for you the very same way your doctor does. We are going to be there to give you that one-on-one care. We are going to be there to give you that wonderful delivery and birthing experience that you hoped for. Of course, not every experience will be the greatest. There are some things that will potentially come about that no one had any control over, not even you as the patient, not even the baby as a patient. But sometimes there will be situations that do become emergent, but do know that you are in good hands when you have those situations occur. But know that you're still in great hands when in fact you have us taking care of you. The one lovely thing about our profession is that we don't work a lot of long and extensive days and hours. Many of us often work either 12-hour shifts. Some of us do 24-hour shifts. However, during that period of time, we do, in some cases, have to respond to several things in a hospital setting. It depends on the hospital. It depends on the acuity of the patients. And it also depends on how busy a hospital is. So there are shifts that can be grueling, but you also have to understand we only do about 5 to 7 shifts a month. So we have the ability to be able to go and rejuvenate, renew, and sort of regroup ourselves, because we only are doing that 7 times in a month, where some doctors are working, on call every 3 to 4 days, or sometimes in my case, every couple of days or 1 to 2 days. Some physicians are still solo practitioners and they take care of their patients by themselves. So which means that they may not have anybody to basically be on call for them for extended periods of time, but they may use the hospitalist or, laborist services when they are out of town to deliver their babies, which is why we're there to give them their reprieve as well. For those patients who are kind of wondering how all of this works, this is how it works. And so it depends on your doctor's office. It depends on the hospital that you go to in terms of whether or not we exist there and the model, really. And so it's a great thing to have us around, even if your doctor does plan to deliver you, because if your doctor ever needs help with anything, they have another set of hands to be able to do that. Even for your C-sections or your difficult vaginal deliveries, there's another set of hands that's always around when we are available. And the other thing, that I think, people should know is that when you go and you speak with your physician, just know what kind of model they have. Do they use laborists? Do they use hospitals where there are laborists? Will they be the one delivering you, or will somebody in their group be delivering you? Should you meet everyone in their group? And, you may not necessarily get a chance to meet all of the laborists that are at a particular hospital. But if you ever wanted to visit a hospital where there are hospitalists or laborists, you can always do that as well. So I hope that this was helpful, not only for patients, but also for my colleagues out there. We love what we do, and I'm very grateful for the fact of what I decided to do in my life and switching over and being able to have the time with my family and to still enjoy my profession. I work for one of the largest hospitalist groups in the country. I've been treated extremely well with my company and would not trade it. So I hope this is helpful for everyone. Take care, guys. Until next time, Dr. Rush signing off.